Eyes are primarily in our body for giving us vision. In the ophthalmology clinics, usually we see people coming with one of the two main problems. One is decreased vision, other thing is defective vision. Welcome back to ophthalmology for undergraduates and postgraduate beginners. Let us see what is the difference between a decreased vision and defective vision. We are not supposed to confuse between the two. First is decreased vision. Decreased vision is nothing but dimness of vision. The brightness of the outside world is reduced due to certain diseases. One is the refractory errors. Second is a cataract, vitritis and uveitis. In refractory errors, both the things we see will not be clear as well as the brightness will be reduced, which can be corrected with spectacles. In cataract, the amount of light rays entering into the eye are reduced due to the opacity in the lens or its capsule, leading to decreased vision. In vitritis and uveitis, due to outpouring of cells and proteins into the aqueous humor and vitreous humor, the amount of light rays entering into the eye and falling on the retina are reduced, leading to decreased vision. Coming to the defective vision. What is defective vision? Within the visual field, certain portions are not seen. So that is called as defective vision. It has nothing to do with decrease in the brightness or dimness of vision. So I have drawn several pictures here. Let us see one by one. You can see here the superior portion in the visual field is not seen. This is called as altitudinal field defect. It may be a superior portion or inferior portion that is not seen. This is classical of ischemic optic neuropathies. This is hemianopia. One portion of the visual field is not seen. Hemianopia is classically seen in visual pathway lesions, that is, lesions affecting the optic chiasma, optic tract, lateral geniculate body, optic radiation and visual cortex. Next is central scotoma. Central scotoma, that is, central portion of the vision is not clear. The periphery will be clear. There will be a dark spot in our field in the center. Whichever object you are trying to see, that portion will become dark, the periphery will be seen. So this is classically seen in macular lesions in the retina. Common lesions are age-related macular degeneration, central serous retinopathy, clinically significant macular edema. So many conditions affecting the macula. Next is the tubular vision. The central vision alone is clear, the periphery is dark. This is classical of peripheral retinal diseases. Common examples are retinitis pigmentosa, where the outer rod containing retina is affected. The central cone containing macula alone is able to function properly. So there will be a tubular vision. It can also be seen in extreme conditions of glaucoma, where there will be tubular vision also. Next is quadrant anopia. Quadrant anopia is 1/4 of the visual field is not seen. This is very classical of optic radiation lesion in the temporal lobe or in the parietal lobe, leading to quadrant anopia. Total loss of vision, that is, the entire eye becomes blind due to disease of both sides, visual cortex, disease of the optic nerve. Optic nerve is totally damaged. So that can lead to blindness in the one eye. You can have defective vision in some portions of the field anywhere, like this. This is a scotoma present in a peripheral portion of the retina. There may be a retinitis in a small portion. There may be a chorioretinitis in a small portion. There may be a vascular block. So one portion, the vessel is not supplying the retina due to the blockage, leading to loss of vision for the objects that are falling on that portion of the retina. Coming to glaucoma, I want to tell few things. glaucoma can lead to defective vision. There are several types of defective vision in glaucoma: paracentral scotoma, sedal scotoma, arcuate scotoma, biarcuate scotoma, constriction of visual field, tubular vision, and finally total loss of vision. Sometimes defective vision can also be seen in corneal lesions. Corneal lesions means if there is central corneal opacity, leukomatous corneal opacity, totally all the light rays are blocked into the eye, leading to darkness. If there's a paracentral corneal opacity, what will happen? Whatever objects we are seeing in the outside world, from particular objects where from the lights are coming, may be blocked by the corneal opacity in the paracentral area, so that that particular object or portion of the visual field alone is not seen. So I have told briefly about difference between decreased vision and defective vision. We should never confuse while presenting cases. While telling the complaints, we have to tell whether it is decreased vision or defective vision. Then only our case presentation will go on smoothly without any mistakes. We will stop here. We will see in another video soon.